Can pancreatic cyst surveillance avoid invasive EUS-FNA? Have you ever wondered if monitoring pancreatic cysts could help you avoid invasive procedures? This is a crucial question for many facing pancreatic health concerns. Pancreatic cysts are fluid-filled sacs that can develop in the pancreas. While most are benign, some can pose risks. Surveillance through imaging techniques like magnetic resonance imaging, computed tomography, and magnetic resonance cholangiopancreatography can often safely monitor these cysts, especially those without high-risk features. This approach may help avoid the need for invasive procedures like endoscopic ultrasound-guided fine needle aspiration. The key to effective surveillance lies in risk stratification. Medical guidelines suggest monitoring cysts that lack high-risk features. High-risk features include main pancreatic duct dilation of 10 millimeters or more, obstructive jaundice, mural nodules of 5 millimeters or larger, or suspicious cytology results. Cysts with only mild worrisome features, such as sizes of 3 centimeters or larger or small mural nodules, can often be followed with periodic imaging. This allows healthcare providers to detect any changes before considering invasive procedures. Surveillance intervals can vary based on the cyst's characteristics. Some consensus groups recommend magnetic resonance imaging every 1 to 2 years, while others may suggest more frequent imaging, like every 6 months to annually. For certain types of cysts, such as intraductal papillary mucinous neoplasms, lifelong surveillance may be recommended. Research supports the effectiveness of surveillance. Studies show that patients with pancreatic cysts larger than 3 centimeters but without other concerning features can often be monitored safely. Over several years, the rates of progression to malignancy in these cases have been low. In fact, when surgery was performed later, no cancers were found in many cases. However, there are limitations to relying solely on imaging. Endoscopic ultrasound-guided fine needle aspiration remains important when cysts develop high-risk features or when imaging results are unclear. This procedure allows for cyst fluid sampling, which can provide valuable information for risk assessment. Emerging molecular testing techniques are also showing promise in improving risk assessment. These advanced tests analyze cyst fluid at a molecular level and may help reduce the need for invasive procedures in the future. However, they are not yet widely available or integrated into standard guidelines. In summary, pancreatic cyst surveillance through regular imaging can often avoid invasive procedures for patients without high-risk features. This approach allows for safe monitoring of cyst stability and early detection of any changes. Nonetheless, endoscopic ultrasound-guided fine needle aspiration remains a vital tool for managing cysts that show worrisome changes. It is essential for patients to discuss their individual circumstances with healthcare professionals to determine the best surveillance strategy based on their specific cyst characteristics and overall health.